So here's a quick little tip. Leg curls on a physio ball. Lots of people do them on a machine. I prefer them on the physio ball. In a strength and conditioning setting, you would hear these referred to as a shelk, S-H-E-L-K. That's just a fancy way of saying, or an acronym for saying, supine hip extension leg curl. In other words, a leg curl on a physio ball. Little tweak you can make if you're struggling to find your hamstrings or to feel them during the movement. The first thing that you really want to watch for is obviously substituting hip extension for glute activation. So what I mean is, initially, you can start out with a smaller ball. The larger ball is obviously going to boost the feet up higher and make it a little bit tougher. But what I mean is, when the person bridges their hips up, instead of actually getting it from glute activation, here, squeezing the butt, they actually will get it from the spinal erectors. So here my glutes are not turned on whatsoever. You can tell I'm more unstable in terms of rocking side to side. So what you want to make sure to focus on is actually squeezing the glutes to bring the hips up. Now I used to coach this and tell people you need a straight line from your knee to your hip to your shoulder. And what I found is that actually caused people to default into more of this overextended position. Obviously, if your hip extension is good, or quote unquote ideal, that's where you should be able to get. But in some folks, what you're going to find is that the spinal erectors turn on, especially during the set. So as you're going through these reps, if you focus on the glutes, what you're going to find is there's going to be a little posterior tilt of the pelvis. Obviously, that's what the glutes do. But if you really focus on just squeezing the glutes, then as you come up, you'll never get that straight line because the glutes are firing as well as the hamstring. So now you're getting a shortening of the hamstring at the hip, because we know the hamstrings also help or assist in hip extension, but you're also getting a shortening of the hamstrings at the knee. So now you're getting shortening across both joints, and you're going to get a much harder contraction. Next tweak. Let's take a foam roller. If you have a foam Eric's pad, one of those big blue pads that you see in some facilities, you can use that. Put it in between your knees. The purpose of this is just to simply cue your adductors a little bit more. With this, you're going to find that then as you squeeze the glutes, you're also going to have to press together on the roller. So it's going to be tougher to squeeze the glutes as hard because obviously the adductors and the glutes work reciprocally in the frontal plane. So obviously glute med works femur into horizontal abduction, whereas the adductors bring the femur in horizontal adduction. So in this case, we're trying to get the adductors to fire a little bit more, and this one you're going to feel more of the medial hamstring on the inside of your leg fire. So again, focus on pushing into the roller with both knees, and then curl up, and you're going to get a much harder contraction, especially on that medial hamstring. Semimembranosus, semitendinosus. So quick little tip, use this guy if you're really not feeling the hamstrings during the leg curl. And if you don't use this leg curl variation, I would highly recommend it. It's excellent for really shortening both ends of the hamstring, which you don't always get in a seated leg curl or a lying leg curl. So really good variation here, try it out, and then add the foam roller and give it a shot.